Narrator, voiceover. Myasthenia gravis, or MG, is a rare, chronic autoimmune disorder that affects the communication between the nerves and muscles, causing muscle weakness. This condition can affect various muscles in the body, especially those that control eye movements, facial expressions, swallowing, and breathing. Cut to an animation of a healthy nerve-muscle junction, showing normal transmission of signals. Narrator, voiceover. Under normal conditions, nerves release a chemical messenger called acetylcholine, which binds to receptors on muscles, signaling them to contract. Cut to an animation showing the immune system attacking acetylcholine receptors. Narrator, voiceover. In MG, the body's immune system mistakenly attacks and destroys these acetylcholine receptors, preventing effective communication between the nerves and muscles. Cut to a woman, Sarah, who looks fatigued and struggles with lifting her arm. Narrator, voiceover. The symptoms of myasthenia gravis vary from person to person, but the most common signs include muscle weakness that worsens with activity and improves with rest. Cut to a close-up of Sarah having difficulty holding her eyelids open, then transitioning to her facial expression becoming droopy. Narrator, voiceover. One of the most noticeable early symptoms is ptosis, or drooping of the eyelids. This can be followed by weakness in the muscles that control facial expression, chewing, swallowing, and even breathing. Cut to Sarah having difficulty swallowing food and struggling with her speech. Narrator, voiceover. People with MG may also experience difficulty swallowing, double vision, and weakness in the limbs. Cut to a doctor's office with Sarah speaking to a neurologist. Doctor, to Sarah, to diagnose myasthenia gravis, will perform a series of tests. This includes blood tests to look for antibodies, a physical exam, and possibly a test called the edrophonium test, which temporarily improves muscle strength. Cut to Sarah undergoing an edrophonium test. Narrator, voiceover. The edrophonium test involves administering a drug that briefly enhances communication between the nerve and muscle, providing insight into the presence of MG. Cut to Sarah having an EMG test. Narrator, voiceover. Another diagnostic tool is the electromyography, EMG, which tests the electrical activity of muscles and helps detect abnormal nerve-muscle interaction. Cut to a hospital setting where Sarah is being treated. Narrator, voiceover. While there is currently no cure for myasthenia gravis, treatments can help manage symptoms and improve quality of life. Cut to a pharmacist discussing medication with Sarah. Narrator, voiceover. Cholinesterase inhibitors, such as Mysthenia, are commonly prescribed to improve the communication between nerves and muscles by increasing acetylcholine levels. Cut to Sarah receiving an intravenous infusion of immunosuppressive drugs. Narrator, voiceover. Immunosuppressive drugs can also be used to reduce the production of antibodies that attack the acetylcholine receptors. Cut to a surgical procedure where a doctor is removing the thymus gland. Narrator, voiceover. In some cases, the thymus gland, which may contribute to the abnormal immune response, is removed through surgery.